Hoffman's death has focused our attention on the dangerous surge in heroin use in the U.S., the number of users nearly doubling between 2005 and 2012.
Joining us to talk about heroin and addiction is drug and alcohol addiction expert, the founder of the Hills Treatment Center, and recovering heroin addict himself, Dr. Howard Samuels. Doctor, good morning.
Good morning.
We'll start with this bit of information, and of course it's coming out as they're doing the investigation, but dozens of bags of a drug stamped Ace of Spades and Ace of Hearts were reportedly found in his apartment, Phillip Seymour Hoffman's apartment. Is that just a new trendy name for essentially a deadly drug known as heroin?
Well, you have to understand there are a lot of street names of heroin on the streets of New York. You know, there are different brands. You know, so all Ace of Spades is a certain brand of heroin. When I was shooting heroin on the streets of New York, one of the popular brands was called Poison. Okay? And, you know, now what's so interesting and sort of sick is that when you hear someone dies from a particular brand, all of a sudden that brand becomes very popular because it shows the other addicts how powerful and good that particular heroin is, that it was so powerful it would kill somebody. And so when I would hear, or my friends would hear, we would run and get that brand.
Well, and does that sort of speak to what's happening in sort of the psychology of the heroin addict, that they're actually running towards something that they know could kill them?
Well, you see, the addict doesn't think that way. The addict thinks, oh, I'm running towards it because it's so good, that the addict feels, okay, I have to be careful in shooting this brand, but they're excited because it's so powerful. And they'll always look at someone else dying as, oh, they made a mistake. They didn't really know what they were doing. That's how the addict will rationalize doing that powerful drug.
We're also seeing a rise in heroin use amongst people that are using prescription pills or addicts of prescription pills. What's the connection there, not as well as teenagers? You can talk to both points.
Well, there's a couple of, categories of why heroin's got more popular. Number one, OxyContin used to be able to be crushed. You could snort it, you could shoot it. But see, OxyContin now, with the pharmaceutical companies, are making it more of a gel. So you can't do that. You can't get that rush from OxyContin by crushing it up. And OxyContin and a lot of the opiate pills are very expensive. They go $30, $40 a pill, whereas heroin has become much cheaper. It is $8 a bag. It's much more involved. Even the governor of Vermont made his State of the Union address all about how heroin has become a crisis in the state of Vermont. So it's pushed out from the urban areas into the rural and suburb areas now.
You mentioned the fact that you used to shoot heroin
Yes.
in New York. You've been sober for many years.
29 years.
29 years. Phillip Seymour Hoffman, reportedly sober for 23 years. For those of us who don't struggle with this, you think, okay, you're not struggling with it anymore.
Right.
How does it happen that 23 years later he circles back to something that he knows could kill him?
Well, you have to understand is that when you are an addict or even an alcoholic, it's a lifelong disease. And if you're going to stay in remission from that disease and stay in recovery, you have to be very involved in the recovery community. The reason I have 29 years is I'm very involved in the recovery community. I'm in the middle. Recovery is the most important thing in my life. Now, a lot of people, their lives get big. They get involved. They get caught up in, career and stuff. And they start to lose touch with their recovery, and they get on the outside, and they get picked off.
I see.
Because this drug is on the rise, especially amongst teens, what do you tell parents? What do they look for? And I'm sure parents are likely to say, not my child. My child wouldn't do this. This is some drug that happens on the streets and not in my neighborhood.
It doesn't start with heroin. It starts with marijuana. That's how it started with me. And that's how it started with most of all the addicts I treat and work with. So you really have to look as a parent to attitude changes, mood swings, sleeping most of the day, coming in late, doing horrific at school. It's the education of the family that is essential to being able to try to stem this flow of this crisis, this drug crisis in our country.
If there's something we can do to save someone's life right now, they're watching, they're struggling with heroin addiction, they don't know the first step to take. What do you tell them? What do they do right now?
Well, first of all, I would say call the Hills Treatment Center where I work. We'll definitely help you. We'll definitely give you advice. Call someone who's in recovery. Call an addiction specialist. You know, you have to reach out and get help. You can't do this alone as a family because you're too in it. Yeah. You know, you need somebody to help direct you and give you direction and advice.
All right.
Great information, Doctor. And for more on Dr. Howard Samuels and the Hills Treatment Center, you can go to thehillscenter.com. Thanks so much for joining us this morning.
You're welcome.